Welcome to Community Conversations with Louisville Pride, part of our Digital Pride initiative. Community Conversations happen Tuesday and Thursdays at 1 p.m. on Facebook Live. They're available for viewing and download later on our website, louisvillepride.com/community-conversations. We're also available for download in podcast form at Anchor FM and on Spotify. As part of our Digital Pride initiative, we're also working with the Fairness Campaign and other groups to coordinate a Louisville LGBTQ COVID-19 response call, which is a weekly conference call we do with social service agencies and LGBTQ groups, and a portion of that is shared on Facebook Live so people can watch and hear the updates live and ask questions. We also have a live drag show every Friday at 8 p.m. That's been on Facebook Live, but we're going to move it to Mixcloud and Twitch coming up. And that's a fundraiser for the Louisville Pride Foundation and the One Louisville COVID-19 Relief Fund, and for the performers who are out of work right now. We want to thank our sponsors, local UAW 862, Norton Healthcare, Connolly Law Offices, Caperton Realty, Evo Mortgage, Heine Brothers, and the Fairness Campaign. Today's topic is Metro Government and how COVID-19 is impacting them. And our guests today are Mayor Greg Fischer and Chief Equity Officer Kendall Boyd. Greg Fischer was elected Louisville's 50th mayor in 2010 and was sworn in for a third four-year term on January 5th, 2019. During his tenure, Louisville has experienced a renaissance, adding 83,000 jobs and 3,000 new businesses, with more than $15 billion in capital construction planned or underway. Louisville has been named an International Model City of Compassion 4 times and was a 2018 top 15 city for attracting millennials. Mayor Fischer has been elected by the Mayors of America to be the president of the U.S. Conference of Mayors in 2020. Kendall Boyd has been with Metro Government since 2014. He previously served as the Assistant Director of Human Resources and the Executive Director of the Human Relations Commission. He was appointed by Mayor Fischer to be the Chief Equity Officer earlier this year. And if I'm not mistaken, Kendall, you began in that role yesterday. Is that correct?
Yes, officially, yes.
Well, thank you. I'm glad, I guess you don't have a full schedule on that second day of work, right? Thank you for joining us today. And before we dive in, I just wanted to see, Mayor Fischer, can you give us an update on the number of cases and deaths in Jefferson County?
Yes, unfortunately, yesterday we passed the century mark with deceased. We have 102 folks that have passed in Jefferson County. And I think that our positives are around 1,400 or so, Mike. That's a number people like to hear, but it's really not any kind of reflection on the number of folks that have the virus in the community. What we're really emphasizing and focusing on is increasing the number of tests that we have available in different parts of the community. So as we reopen the community, we can understand if the virus is trying to make a comeback, and so we can lock that down as quickly as possible. But sadly, 102 deaths. The community's done a nice job in terms of flattening the curve. We didn't see our hospital system overrun with, so I'm proud of our community and grateful for that. And we need to stay focused and keep it that way.
Great, thank you very much. Anybody's watching along, if you have any questions, you can post those in the comments, and we'll try to get to them. So first of all, I wanted to say that, for a lot of people, they only experience Metro Government as trash collection and parking tickets and things like that are not major parts of their lives. But for many people, Metro services are a matter of life and death. Can you tell us a little bit about who depends on city services and what Metro's doing to help them in these unusual times?
Sure. I frequently say people take government for granted, just kind of like oxygen. You think it's going to be there. And you really notice it when there's a crisis or our resources are stretched thin. So one example is our public health department. Most people didn't give it any kind of thought until this pandemic came upon us. And they've been the ones issuing the guidance to keep our community safe as we go through this pandemic. Also giving us the advice on, social distancing, wearing face masks, all the public health protocols that our city's been able to really execute pretty well to keep this COVID virus somewhat under control. And I just say somewhat because I just said we had 102 deaths, which each one is one too many. But when we take a look at what's happened in some other cities around the world where the healthcare system has just been overrun, it's led to massive numbers of deaths and lots of suffering as well. So that's an example of one group that people just really don't really think about that much. Another one is our community services and revitalization group that has been leading the social service charge during this crisis. So what we're really facing with COVID is we're facing a health crisis, a financial crisis, and a social service crisis. And one of the things I'm really proud of what our community services and resilience has done is taking care of our being our liaison for the One Louisville COVID-19 Relief Fund. Mike, when this virus was in the country, I said before it got to Louisville, we need to stand up an emergency relief fund because some people are going to really be negatively impacted by this. And so yesterday was a big milestone for the fund. We announced we've raised now over $10 million in the community, and the direct relief to individuals and families is being organized by our community services and resilience group. So think about the massive impact that's done on them from, let's say, administering 100 cases a month now to thousands of months. And their response to getting that money out to individuals and families has been just fantastic. So those are two agencies that people may not think of, but most every aspect of what you experience as a person, somehow local government is involved with that.
You mentioned the Department of Resilience and Community Services, and the former director of that is Eric Friedlander, who people who watch the briefings with Andy Bashir have seen him on there a lot. I know a major focus of your administration has been on equity, resilience, and compassion. We've heard those words a lot. And I think this is a situation that really puts all three of those areas to the test. So my question for you is, have those just been buzzwords, or has that approach really helped Metro in preparing for and coping with this crisis?
No, they're much more than buzzwords. I'll throw that to Kendall, and then I'll come back and add some comments after that. But let's talk about policy, procedure, focus, Kendall, and then I'll add a few thoughts.
Yes, absolutely. Yeah, equity is basically the framework of my job and what I'm supposed to do every day. As part of this response to the pandemic, I've interwoven equity into all the response efforts that Metro has put forward. Little things that you don't think about or that would skip your mind unless it came back to haunt you, come through this equity work. For example, our LGBT populations are being disproportionately impacted by this pandemic because of pre-existing health conditions. For example, if someone has HIV or is HIV positive, this pandemic and this virus impacts your body way different than it does a healthy, able-bodied person. So with respect to our response efforts, if we don't put this equitable lens on, we would not be able to recognize that disproportionate impact. So that's just like one example. Equity and compassion, they're more than just buzzwords. They're the way that we live and we operate every day. Every day, the mayor's facing challenges with respect to all the operations of government, whether it's budget, whether it's labor, whether it's personnel, something like that. And we have to interweave that equity lens into everything that we do as part of our response effort.
So a few other examples. We're in now what we're calling our second phase, the gradual reopening of the public. Our third phase is when we're really reimagining what Louisville can be, and I hope the whole country can do that as well. And so that phase 3, we call it building back better together, emphasis on together. So that phase of the effort is being led by Kendall Boyd, our Chief Equity Officer, and Mary Ellen Wiederwall, our Chief of Louisville Forward. So it's an economic lens and an equity lens as well. And then as we faced decision points throughout this pandemic, our response has had to be equitable because let's take, for instance, we have disproportionate amounts of deaths taking place in our African-American community. About 22 to 23% of Louisville's population is African-American. About 30 to 32% of the deaths are African-American. So you can say, what does that mean from a practical response standpoint? So when you see where we're putting our major testing facilities for COVID, Shawnee Park, and then Bashford Manor, so close to the Newburgh area. So we're intentionally placing these where we have more dense concentration where people of color are living so that they can understand where they're at relative to COVID-19. So those are just a couple of examples, but we don't want to come back out of this, Mike, just to the normal. We want a better normal. where everybody feels like they've got the kind of access that they should have to education, to healthcare, to housing, to food, to upward mobility in life. And as you know, Louisville was the first city in the country some probably 12 years ago now to have a Center for Health Equity. So this pandemic is really putting a spotlight on the social determinants of health. And I've had people, it's interesting, when they've seen this, for instance, this disproportionality in deaths of our Black community, say, well, I wonder why that's happening. You know, so they never really registered these social determinants of health or legacies of institutional racism that have led to this disproportionate impact on, especially, you know, on the non-Caucasian communities. So my hope is that when we come out of this, we have a better America and a better Louisville.
Certainly, we all hope so for that. You know, no one knew that this was coming a year ago, but would you say that the city was reasonably well prepared for the crisis? You know, what would you have wanted to have in place that wasn't there?
Yeah, one of the good things about city government is there's lots of cohorts that you can learn from. So we're involved in lots of them. Everything from Rockefeller Foundation is working with a small group of cities on testing to make sure that we're at the front end of that. Bloomberg Philanthropies, Johns Hopkins, and Harvard were part of that weekly learning session also. And then, of course, we've got the United States Conference of Mayors. So we can see where we're at compared to other cities, and we are ahead of the curve, frankly, on some of these issues. And I think part of that is our public health department, when the hepatitis A crisis came through the city a year or two ago, really both executed well. Their response was called the gold standard by the Center for Disease Control. So, you know, we have some experience. There's been that it was nothing like what we're facing right now, but we had a framework to be able to respond, to understand good public health advice, to start the contact tracing that's required to try to mitigate the impact of the virus. So we were prepared in that way, but I can tell you, not just Louisville, but every level of government through this pandemic has been tested by the depth of our teams, because we are lean in normal times. And then when you put a pandemic on top of whatever our normal daily work is, I mean, it really stretches you, right? So I would love to have, for instance, 2 people for every 1 person we have right now to really swarm this thing with everything that we've got. So that would be my biggest reflection. And we've brought in outside folks to help us, particularly as it relates to the testing and tracing aspect of COVID-19. That's the stage we're in right now. And people are going to learn a lot more about the importance of regular testing and tracing. So that builds the confidence so people then are ready to engage back with the economy.
And speaking of the economy and how much this stresses city government, on top of everything being closed, we've had to miss Derby, which is the single biggest economic event in our community and has a massive impact on the economy and the city budget. The city budget, which you all are working on right now, is already pared to the bone. So going forward, how do you balance resilience, equity, and compassion when you're going to have to be making a budget that is, you know, austere would be good compared to what we're looking at? So how do you make those tough decisions when you are in this, you know, really probably a nightmare of a budget?
We are in a nightmare of a budget cycle. Our new budget starts July the 1st. There is one extraordinarily material action that is going to impact this budget for good or for bad. And that is, how will the federal government respond to the needs of state and local governments? In our case, we will have had a negative impact of about $115 million between closing out this year's budget and starting next year's budget. If we do not get direct relief from the federal government, we're talking about eliminating almost 1,000 positions in Metro government out of 5,200. That 5,200 was down from 5,600 some 8 years ago. So we've already leaned out, as you could say. But just like the federal government has helped big businesses and small businesses and payroll protection programs and emergency loans, we are intent on communicating the need to give local and state governments that same type of assistance. because I can tell you, Mike, the general economy is not going to come back if basic government services are not working properly. So when you think about 20% fewer sanitation workers or police officers or paramedics, whatever it might can be, each one of these has a dramatic impact on a city's ability to run. So this week, next week will really be determinative weeks in Washington, D.C. as to what we can expect at the local government level. So would really encourage people to contact U.S. senators, congressmen, to make sure they understand the importance of supporting local government. Absent that, we're going to be in trouble with our budget, as I said. So we're just really focused right now on getting the relief. In the meantime, we have a continuation budget, which means we're just spending at the same levels that we have been. Of course, we've got a hiring frost in place. We still would like to supplement some of our public safety departments. But we're just now really focused on getting that direct relief out there so we don't have to deal with this incredible layoff termination process we'd have to go to, and which would be so cruel. And that now the very people that we are relying on to help us get through this pandemic, now all of a sudden we're going to have to say, well, we don't have any money to hire you guys anymore. That's not right. So I'm hopeful that we'll get this relief from the federal government. And when I say federal government, we got to remember that's us, okay? We people make up the government, whether it's local, state, or federal. So we have to demand that we need to have these type of services that we deserve here.
Kendall, I know that Metro Council recently added a goal for a portion of the city's spending to be with LGBTQ-owned businesses. This is something that Civitas, the LGBT Chamber of Commerce locally, worked with the city on to add those goals for spending. Do equity goals like that stay in place during a crisis, or when you're in a state of emergency, does that go out the window?
No, they absolutely stay in place. I mean, to Mayor Fischer's point, we're all in this together. It's basically, we actually look for minority, female, disabled owned, and LGBTQ owned businesses to help us because this pandemic impacts us all. It would be foolish to throw those goals out of the window under the auspice of effective government during a time of pandemic. No, we need everybody's help in this. And if you can provide a product or a service that will help us provide more of an equitable response to this pandemic, then I would hope to go above the goals that we've set for these type of businesses.
Yeah, just to add on to that too, Mike, I mean, we're really happy to launch the LGBTQ Chamber. And so when you think about what makes us interesting as a community, it's just this kind of broad mosaic of whom we are. So LGBT community, our foreign-born community, we're a much more interesting and vibrant city now as we've added to the demographics of who we are. And cities of the future are going to be that way also. So these are areas that have proven to be very effective for us from an economic standpoint. More importantly, they are imperative from a moral standpoint, in my view. And I believe the majority of the citizens, vast majority of the citizens see that. So however we can use city government as a platform to accentuate those advantages that we have as a community, we're going to keep doing that.
I want to talk about a couple of the specific things that Louisville's been doing to respond to this. One of the things that got some criticism were some people were upset that when the parks were implementing different changes, basketball goal rims were coming down, but the golf courses were staying open. Can you talk about some of the thought process that goes into these tough decisions about what to close and what to stay open?
Yeah, that was interesting to observe that conversation. Kind of people kind of automatically retreat to a certain position. So part of our job is to make sure that we're communicating thoroughly so people understand them. So the first lens we have on all this is public health and safety, right? So we recognize that people are not all going just to stay in their house nonstop. They need to get outside. They need to get some fresh air, and it needs to be done in a safe way. So when you compare these two instances, and they are interesting because they have racial stereotypes associated with them as well, which I think is also kind of interesting because not everybody that plays basketball is black. Not everybody that plays golf is white. So it's like we're saying, well, should we close down the Shawnee Golf Course where the majority of the patrons are African American? So it's educational when you kind of go into these conversations. So think about these two different sports, right? So golf is pretty much a solitary sport. It's not a team sport. It's easy to social distance. You can put rules in place to make sure it is social distancing, for instance, with usage of carts, one per person. So that can be done safely, right? Basketball, on the other hand, is a team sport, and you're throwing a ball back and forth to you, which can have the virus on it. You're having physical contact, heavy breathing, so lots more risky behavior relative to passing of the virus. So that's an easy kind of contrast to make with which one is safe from a public safety standpoint, and then the other standpoint. So then you raise a question, well, then is it fair? Is it fair that people can still golf while you can't play basketball? Then I think that gets into the racial stereotyping, of saying, well, wait a minute, are we saying that only people that are Black play basketball and only people that are white play golf? Of course not. So, but it had led to some interesting conversations. But anyway, it came back to this determinant, is it safe or not? If it's safe, we want to keep it going.
And what are some of the steps that the city's taken to keep vulnerable populations safe? And specifically, I'd like to know about homeless people and inmates in Metro Corrections.
Mm-hmm. We have what we call Big Four that we're always watching because they have higher risk factors. So the first is our seniors that live in our nursing facilities, in particular skilled nursing facilities, our jail population, because they've been some real hot spots around the country, jails and prisons, our homeless population because of the more vulnerable manner in which they live. And then the fourth category we just call other dense housing, where people are closely situated together. So as it relates to homelessness, we stood up very quickly an additional homeless shelter of 150 beds with Salvation Army at the old Male High School campus, and an additional 150 beds in South Louisville. The Salvation Army also owns that. And that was going to be for homeless folks that required quarantining. They had COVID-19, but they needed to be quarantined. So it was a more individualized approach there. We have been just really pleasantly surprised and a little baffled that we have not had more problems in terms of COVID positive situations in our homeless community. We continue to monitor that very closely. We're increasing testing, so we understand that. But so that's an example of a specific program for a vulnerable population. Inmates, same issue. With this national recognition, there's been some real hot spots around the country. So how then do we make sure this is not going to happen at Metro Corrections? A couple ways. Number one, we worked with the judges to reduce the population of the jail. Jail's average population is around 1,800 inmates. It's at 1,200 inmates right now. Okay, now a question I would ask is, if it's at 1,200 right now, why can't it always be at 1,200? There have been some releases that have been questionable, but for those that have not been questionable, it's when I say questionable, let's say someone that's charged with the homicide and they're released the next day, that needs to be looked into a little bit more. But that's a big number there. Okay, so reduction of population so you can have more social distancing within the jail. And then on the entry process of folks coming into the jail, making sure that each one of them are tested for any COVID type symptoms. Testing in the jail facility, we've tested around 200 inmates so far. All of them have been negative. But where we're seeing our problem pop up now, and this has been a material change in the last week, is with the staff at the jail. We went from basically, I think it was 1 or 2 folks that had COVID positive, where we've had, I think, 7 to 9 here in the last 5 days or so. So we have an additional focus on this, an additional testing plan on this at the jail, because it can spread very quickly in an environment like that that's a 24/7 boxed in type of environment. Kendall, do you want to add anything to that?
Just through the research we've done, and we've expressed it to you, Mayor, looking at correctional facilities all across the country, they can be hotbeds for this virus. And so it takes special thought, special care to ensure that corrections officers and personnel are protected and the inmates are protected. And there's a lot of strategic moves that we have to make in order to ensure that that happens.
Yeah.
And am I correct in believing that you all also put out portable restrooms and hand sanitizer stations in places where homeless populations congregate?
We did because, normally they would use the facilities in restaurants. But with the closure of restaurants, there was nowhere for them to use bathroom facilities or wash their hands. And of course, we're asking people to wash their hands more often than not. So that was an instance where we quickly put those out and worked with our homeless experts in the community to spot them appropriately.
I'm curious about that because it kind of speaks to the nuance of government, where everything is much more complicated than people think at the outset, because you close restaurants and coffee shops and you're cutting off access to bathrooms for homeless people. So where did that initiative come from? Was that something that came up from the staff or from the shelters or the public?
Oh, kind of we've got listening posts all over, and they tend to come in real quickly. What raised that so quickly is when you think about, okay, homeless population, if they don't have a place to use the bathroom, where are they going to use it? So our downtown ambassadors all of a sudden, like almost overnight, see an increased amount of people defecating outside. So human waste then on our sidewalks in between buildings. So that quickly says, like, okay, something has changed. How do we need to respond to that? So you got to move very quickly and have open lines of communication. And it just, again, spotlights how desperate some people's conditions are, and really needs to ask the question, here we are in the United States of America. Should this be the way that people are living? And this is what I hope when we say we want to come out on the other side of this, a far better country, that everybody should have the basics covered: housing, healthcare, food. But this pandemic did not cause these problems in our country, but it has really put the spotlight on them. So I just call on everybody to make sure that we're asking for a better society as we come out of this virus.
Absolutely. And I think one of the things that, shows how much of a compassionate city we are is how quickly the One Louisville COVID-19 fund came together. Can you talk a little bit about that? You mentioned that you've passed the $10 million mark in funds raised. How did that come together, and how are those funds being distributed, and how are we making sure that that's happening in an equitable manner, that they're getting to the people who need them?
Sure. Fortunately, we had already been working on establishing an emergency response fund. I had just returned from a mayor's conference where we had a panel of mayors that unfortunately were part of an alumni of brothers and sisters whose communities had experienced mass shootings. So one of the things that we've learned as a result of that, people want to help those victims after a mass shooting. So one of my takeaways from that was we should have an emergency fund set up in the event that we have a mass shooting in our city. I hate to even contemplate that, but it can happen anywhere. So we were just days away from having an emergency fund set up. That was fortunate from that regard. So the fund was set up, and then I asked Ashley Parrott from my office to lead that effort. Ashley's over our foundations and other type of giving, and then asked Matthew Barzin to be my proxy to help get this thing stood up. Matthew's an incredible citizen, former ambassador to the United Kingdom under Barack Obama's presidency, well-connected. And he said, I'm in this. To think about these results, Mike, we've had is really quite incredible. As I've talked to other cities, nobody's approaching us in terms of per capita giving. So we've just done a wonderful job. And the gifts have been anywhere from $10 to $1 million. Foundations, lots of individuals. People can help by going to louisvilleky.gov. You can see in the top left corner on the homepage there, you can either donate or you can apply for help as well. And then in terms of how the funds are distributed, I mean, it's almost, I don't know what you call it, Kendall, but I mean, it's equitable by design, right? I mean, it is going to people that literally were living paycheck to paycheck, and the paycheck stopped. So they can't pay the rent, they can't pay their utilities, they can't pay whatever to get food on the table. So the funds are basically about half and half, split up between nonprofits that are delivering services related to COVID-19 in some way, or individuals and families that have that need immediate assistance, and that's again is being done by Resilience and Community Services. So that's how it's all come together, and really proud of our city. Just a great response.
I think it really speaks to what a great city we are. I know you have to hop off, Mayor. Well, I'm going to continue this conversation with Kendall a little bit, but thank you very much for joining us. It's been a very enlightening conversation. Is there anything you want to say before you hop off?
Well, I want to thank you. You know, we've known each other for several years, and you've been an incredible colleague to work with in whatever capacity you're in. So thank you for helping communicate these important issues of the day. And I guess my comment to the public would just be, let's keep doing what we're doing. Stay focused, right? This virus is a stubborn beast and will not go away just because we want it to go away. And we're kind of at the time in the life cycle right now. It's like, okay, we're kind of done with this. It's springtime. Let's act like this is not around anymore. There is no evidence to suggest that this virus is gone. And as soon as we drop our guard, it will roar back. And unfortunately, we will see that in some cities or some states in our country. We do not want to be one of those places. We don't want anybody to be one of those places, but we can control that. So I just want to thank everybody for the good work they've done thus far. Let's keep that going so we can all get through this safely, so we can have better therapeutics and a vaccine on the other side of this, so we can get back to a better normal than what we had before. So thanks, Mike. Appreciate the opportunity.
Great. Thank you very much, Mayor.
All right. Take care. Thanks, Kendall.
Thank you, Mayor. Have a good day. Stay safe and healthy.
All right.
So, Kendall, can you tell us a little bit about, what is the Office of Equity and what, and I know it's only your second day, so you might not know what you do yet, but what do you do over there?
Well, to kind of give you a little bit of background, for the last, I would say 4 or 5 years, we were part of the Government Alliance on Racial Equity cohort, and we explored strategies surrounding how do you implement equity in a government setting, meaning how do you operationalize equity into everything that you do? Because to Mayor Fischer's point, nobody knows how much they rely on government till they realize one of those services has been taken away. One of the things that we found through that work was our operations weren't equitable, meaning different communities were impacted in different ways based upon the work that we were doing. So let's say I'll give like a codes and regs example for, if we're writing many more tickets in West Louisville for ordinance violations versus ordinal violations in East Louisville, what's the root cause here? Why is this occurring? Why are we just giving tickets to some residents in some areas and then other residents in other areas aren't getting any tickets at all? And so in order to do that deeper dive, you've got to put on that equity lens. So what we did was we put together this toolkit to basically look at all of our policies and actions and procedures through that equity lens to see why things happen the way they do. Now, it could be a legitimate reason as to why someone's getting tickets in West Louisville versus East Louisville or South Louisville or something like that. Or are we so quick to write a ticket in West Louisville, but give someone in East Louisville the opportunity to remedy, right? So that's what I mean when we operationalize equity. So basically what the Office of Equity does is we look at all of our policies, all of our rules, all of our ordinances, all of our procedures, actions, anything that the government takes from the mayor all the way down, and ensure that we're getting the most equitable impact as a result. What that does is it provides everybody the opportunity to live free in Louisville. Your biological makeup, to the mayor's point, your biological makeup does not determine your life outcome in Louisville if we impose these equity models.
And the Office of Equity has been around for about 3 years now. Is that correct?
Roughly, yes. Mm-hmm.
And Kelly Watson was the former chief and the first chief, if I'm not mistaken.
Yes.
So I know that's not a huge amount of time, but are there some specific examples you can point to where you've been able to identify and change a problem and make an impact?
Yeah, I mean, just with the development of the Racial Equity Toolkit, we've been able to look at and revise a lot of policies inside of Metro to really impact equity. So for example, procurement, right? Earlier we spoke of the goals and the timetables and utilizing minority, female, disabled owned, and now LGBT businesses. By ordinance, we have specific goals in mind for utilization of those businesses by Louisville Metro Procurement. So what we did was we trained Louisville personnel who are in their agency, they're the primary purchasers in their agency. taught them how to utilize that equity lens and ensuring that we get at least one minority, female, disabled, and now LGBT business enterprise as part of your bid packet. You know, don't just rubber stamp something because you want to buy ink pens from, you know, company ABC when you're not giving somebody else a fair opportunity to be able to bid on something or give them the opportunity to sell Metro something depending on the size of the contract. When we talk about equity, we talk about intentionality. And one part of this equity work that we've been doing is we've been intentional at ensuring that we're utilizing all of the tools at our disposal to bring everybody in into helping Metro do the job that it needs to do. So good faith efforts with respect to utilizing minority, female, disabled owned firms for like major construction projects, for example, having major events with local businesses and stuff like that to really promote their business so that some of the bigger corporations can see what's happening in Louisville and maybe utilize the services or the products of some of those smaller minority, female, or disabled owned firms as well.
So that procurement work doesn't just relate to what Metro's buying. Mm-hmm. You're helping promote that across multiple organizations.
Absolutely. And we're introducing small businesses that otherwise wouldn't have the opportunity to meet some of these major firms as well.
So if you're a small business owner and you're a minority owner and or female owner, LGBTQ owner, disabled person, and I think is veteran status another one of them. Yes. If you're in one of those categories, how do you get invited to the party?
Well, any event that we have, you don't. Well, let me go back. My agency, the Human Relations Commission, we certify those type of businesses, right? So the first step is always get certified. It's easy to do. It's online. All you need is your tax ID information and your business information. And you can go to louisvilleky.gov/human relations, click on certification, and it takes you through the step-by-step process of how to get your business certified in Metro. Once you get certified, you're put on our certified list. We send that list out to everybody. So even if it's not a Metro project, let's say there's a private group that wants to build like a hotel or something like that, we'll attend some of the pre-bid meetings and let them know here's some companies, local small business companies that provide like plumbing or carpentry or electric work or something like that. Please consider utilizing these businesses as part of this overall project. We try to push out and work with our community partners all the information that we get with respect to major events that are going on, whether they're sponsored by Metro or MSD or LG&E or something like that. We always try to encompass the most businesses that we can to be part of that party per se. Because if the same group of people continue to get the same contracts over and over and over again, you're working to the exclusion of so many more people that need help getting their business off the ground, or just can provide a basic service or a basic good, but they're just not given an opportunity to do so. So that's how people get invited to the party. Definitely get certified to get your name out there. Try to attend as many like pre-bid meetings that are advertised as possible. When we have these events, like for example, MSD has a Can You Dig It event every year. It's in your best interest to attend these events to meet some of the major firms that do a lot of this work. Because if they see your face and they know what side of the business or product that you, or service or product that you offer, then you're more likely to be utilized by these type of businesses.
So much of business is all about relationships. And in a lot of these cases, you have these existing relationships, and it's not because anybody's intentionally being inequitable or homophobic or racist. They have their network they've built up, and that's their implicit bias essentially, that they're always going back to the same people. So Absolutely. Building those new relationships is probably a really important part of breaking that cycle. I'm curious, when you take this equity lens, how do you deal with places where there's different minority statuses overlapping, where sometimes we call that being intersectional? So you have LGBTQ people, you have people of color, you have LGBTQ people of color who are experiencing more disparities than people in either of those first two groups. How do you approach that?
Well, that's why it was super important to pass that legislation to get the LGBT businesses certified. To me, that helps close the gap a little bit. Also, I think it helps close the gap that we have these intentional conversations around this to let people know what type of businesses are out there and what's being offered. With the intersectionality, I hate to pit one business against another, but business is a competitive world. We all know that, right? So what we try to do is we try to encourage utilization by more than just one major firm. We try to get all the major firms on board to start utilizing our various businesses that are certified, or even if they're not certified, just utilizing various small local businesses. And we ask that a lot of these major firms who have been successful in their business model to provide basically like mentorship, mentor to smaller businesses. How did you get your business off the ground? If we know someone who's not a minority or not female or not LGBT or is not disabled, but is successful in their business, what's the harm in having them teach someone who is in that category about how to be successful in business? To me, that lifts everybody up, and I think that makes our community a lot better.
And this might be outside of the scope of what you all are looking at or what you can do. Mentorship and relationships and skills and all that is very important. Mm-hmm. But fundamentally, what makes a business succeed or fail is money, and especially access to capital. And that's what we see, like in these crises. The big businesses that can borrow lots of money are going to do better than the small businesses that don't. Is there anything that the Office of Equity can do to help increase of access to capital for small business owners? And I can think of several people I know who are women of color, LGBT women of color, who have business ideas and are struggling to try and find funding that for another part of the community they might just be able to snap their fingers and come up with $10,000 towards something. So what can be done to increase that access to capital?
Right. Yeah, even before this pandemic started, that's always been an unfortunate reality when it comes to working on our traditional business models. A lot of people don't have access to capital, right? To do legitimate business nowadays, after the licensing, the bonding, the insurance, and all that other stuff, if you can get through those pillars first and still be able to operate a business, that means you've got a strong financial capital backing, right? And so what we've been trying to do is we've been trying to work with some of the major institutions to educate people on what the importance of bonding is, what the importance of having insurance is, what the importance of having good credit is, so that they can utilize these traditional institutions to get the money that they need. Since this crisis has kind of put a hold on a lot of that, what we have seen is for the PPP relief and everything like that, is that you still have to go through those traditional institutions to get the relief, which is also unfortunate. I mean, I understand why the federal government did it that way. I mean, businesses that are in the business of loaning money, they're in the best opportunity and best place to be able to administer that type of program, but it still excludes so many people who traditionally just didn't go the traditional route. A lot of successful business through American history didn't go through the bank. Somebody was able to save enough cash and get their business off the ground, and now there's top Fortune 500 companies, right? So the key to that is education, of course. Educate business owners and potential business owners about what strictures are in place in order to run a legitimate business. If you don't meet the credit requirements, or you can't afford the bonds or the insurance or something like that, we often educate businesses on how you get a small start. If you've got a great idea, what's the harm in partnering with somebody who may have capital as well? Put both your capital together and move forward to moving your business model along as well. To answer your question, unfortunately, there's not a lot of wiggle room when it comes to traditional banking methods and things like that. But what we've done is we've brought through the Office of Equity, we brought to attention these institutions the need for small businesses to be given opportunity. If you give them a line of credit to be able to get their business idea off the ground, and they pay that line of credit back, then at that point, they should be in a position to continue to do business with you in the future. So if you take out a $5,000 loan initially and it gets paid back on time, what's the problem with loaning them $10,000 to move the business to the next level? So that's what we do here in Office of Equity.
So, and my last question is kind of a big one, but thinking about the LGBTQ lens, and especially around transgender people and non-binary people, how do you all apply that at Metro in your operations and in the general sense, and then in an emergency? You know, when you're opening a homeless shelter with the Salvation Army for overflow, is there a moment in that where there's somebody saying, okay, well, now if somebody comes in and they're transgender, are we going to let them go into the area that they identify with, you know, for inmates, people like that? Like, how do you all approach that? And how far have you come? How much more is there to do?
Right. You know, we try to, the person as to what they identify with, we try to take our best efforts to allow them to stay in that group, right? Biologically, you may have been born this, but you identify as that. We try to let you go with your identifying gender. However, as Mayor Fischer talked about earlier, we got a safety issue. And I relate that more to gender than like transgender stuff. And when I say that, meaning we want to protect people from like rape and assault and stuff like that, right? I think anybody who identifies as whatever they want to be should be able to live their life free and do so. That's always been my philosophy. Trans or whatever, that doesn't matter to me. Be who you are. At the same time, when you're dealing with a pandemic, like something we've never dealt with before, we're dealing with a disaster and a crisis that we've never seen in our lifetime. And so to ensure the safety and health of persons, we've got to make sure that we're not going to just throw them into a dangerous situation, and not just sexual assault, just, you know, putting them in a situation where they can be harmed by somebody else who is ignorant, who is a bigot, who is prejudiced, right? So we try to utilize our best efforts to allow them to live their life the way they want to, but we have to be cognizant at the same time that they need protection as well. So it's a hard balance. There's no real easy, straightforward answer to that. We just try to do what we can to protect themselves and protect the public.
Well, thank you very much for joining us today, Chief Boyd. I guess, is that the correct title?
Yeah, it's fine. Thank you.
So anything else any closing words of wisdom you'd like to share?
Sure. As Mayor Fischer mentioned right before he got off the interview, this pandemic has really exposed the inequities that exist in our community with respect to like health inequities, and with our African-American community, and all other inequities with respect to women and LGBTQ and everything like that. So, you know, as we get through this pandemic, we have a clean slate to really start over. We've got an Office of Health Equity who's identified several root causes as to why we have percentages of populations that live 20 years longer than other percentages of populations in our community. So now that those root causes have been exposed, and we really see what impact that a pandemic can have on people that have things like pre-existing conditions and stuff like that, now's our time to address that. Now's the time to incorporate healthy living, access to medicine, access to doctor's cares and things like that, to take care of those pre-existing conditions so people can live longer lives and healthier lives as well. I would encourage everybody to continue to social distance, continue to wash your hands, stay in touch just as long as it's on the internet. Check on those who are by themselves as well. One thing that we don't really talk about when we're talking about disability are people that suffer from mental disabilities. A lot of those people are not all right now. They're dealing with something that they've never seen before. There's a lot of anxiety and fear. And so people that have mental illness or mental disparities and things like that, check on them, make sure they're doing all right. We've seen the suicide rate kind of go up, unfortunately, during this pandemic. So, you know, let's look after the people that can't really look after themselves, and let's just take care of each other. We'll do this together.
Well, thank you very much for joining us, Kendall Boyd, the Chief of Equity, and earlier we had Mayor Greg Fischer. On Thursday, our topic is going to be people with disabilities and the impact that COVID-19 has on them. This is part of a series we do Tuesdays and Thursdays at 1. And on Fridays at 8 p.m., we have a live drag show featuring some of Louisville's top performers, and it raises money for the Louisville Pride Foundation, as well as the One Louisville COVID-19 Relief Fund that's managed by the Community Foundation and set up by the city, which has raised over $10 million. I think we can claim a little over $1,000 of that. So, you know, we're doing our part. I want to thank our sponsors for Digital Pride, UAW Local 862, Norton Healthcare, Republic Bank, Evo Mortgage, Fairness Campaign, Heine Brothers Coffee, Caperton Realty, and Connolly Law Offices. So thank you all very much, and be sure to wash your hands.
Yeah. Thanks, Mike, for having me on. Have a good day, buddy. Stay safe.
You too. Bye now.